The largest and now also the deadliest Ebola outbreak in the country's history is still spreading in Democratic Republic of Congo. In the latest report from the National Public Health Institute, there over 100 new cases in 24 hours, and more worrying, a fatality ratio of 46%. The UN says someone is in fact dying from it there every half hour. The current outbreak is a rare strain for which there is no yet approved vaccine or treatment. It's also happening in an area of the northeast which is caught in a bitter conflict. We can speak now to spokesperson for the World Health Organization, Tarik Jašarević. Thanks so much for your time and joining us here on France 24. Can I start by asking you simply the latest information you're hearing from the ground? I mean, the death toll sounds frighteningly high.
Indeed, and you have already said this is the largest outbreak that DRC has ever seen, outbreak of Ebola. There are more than 2,000 confirmed deaths and almost 5,000 confirmed cases. We are really trying to catch up. We are behind the outbreak, and the outbreak is outpacing the response. There are several reasons. You already mentioned the geographic position of Ituri province, that is the epicenter of this outbreak. There is a high mobility of people. There's insecurity. There are other humanitarian needs. But also we know that the outbreak has started months before it has been officially announced, before it has been detected. So the virus had a big head start, and we are trying really to get now to know where those transmission chains are. Unfortunately, that's still not the case. Many people are catching Ebola and dying from Ebola and not getting into treatment centers. And this is really something that we need really to scale up all elements of the response if we are going to stabilize the situation.
If I'm correct, this outbreak was declared in May, and since it was declared, I mean, the fatality ratio seems to have risen from around 20% to nearly 50%. That's not normally the way that goes once, outbreaks have been tracked. And is it the lack of access to care, or what is happening here?
The basic thing is to know where the virus is. And that's really basic approach in epidemiology, to know who is infected and to identify people who have been in contact with this person, and then to monitor those contact people. Unfortunately, we are still not there. And if people are staying at home and not receiving supportive care, their chances of dying are much higher. Even though we don't have a vaccine nor treatment for Bundibugyo virus causing Ebola disease, supportive care is very important. If people get early enough into treatment centers and get that medical care, their chances of survival are bigger. So right now, we really need to catch up to know where are those chains of transmission, to get people who are infected into treatment centers to increase their chances of survival, but also to monitor those around them, making sure that if other people show symptoms, they are also treated. Unfortunately, we are still not there, even though some 18,000 contacts have been listed and being monitored. We still know that there are people out there that our teams are not aware of, and that people are still not coming to treatment centers and infecting other people and dying in the community.
Is that, do you think, mostly because they live in isolated areas? Is it because of the conflict on the ground? Or is there another reason as to why people aren't getting to those centers?
Well, we need to scale up the response. We need to scale up treatment centers. We need to scale up surveillance. We need to have more teams on the ground. But what is really crucial is community engagement. Community really has to take their ownership of the response. Community has to understand that it's in their interest as well to get to the treatment centers early, to make sure that their loved ones are being buried in a safe manner, because Ebola is transmitted when people are at the late stage of disease, when they are being taken care of at home, or just after their death during burials. So those burial practices should be done in the cooperation with the local health authorities who are trying to put in place all those measures. So we need community engagement, but we also need to step up and get resources to local health workers. And again, this is led by the national health authorities, by the Ministry of Health, with support from international partners. But national health authorities need to get all support they need from all of us so they can really step up that response.
And, the symptoms of Ebola, a lot of them sound like flu-like symptoms. I'm like, how would people know when it's time to go and seek help?
Well, it's important to, if you know that there is Ebola in your area, and if you start getting symptoms, to try really to get tested as soon as possible, and that's why we are also ramping up the laboratory capacity. It is a deadly disease, and many people unfortunately do not seek care early enough, or they are afraid to go to health facilities. There are lots of rumors as well in the community, and therefore that it's so important really to get that community engagement, that everyone really understands that many people are dying, and we are seeing the images of graveyards. So it is important that there is a capacity to provide care, to do the surveillance, to do laboratory testing, to do safe burials. On the other hand, we're also working on another track on vaccines and therapeutics. But for the time being, what we need to do is really basic public health measures of knowing where the virus is and treating those who are infected.
Can you tell me where we are on a vaccine? I believe we had one for the initial Ebola strain, but this one we don't. How fast might it come about?
So there are a couple of candidate vaccines, but they need to go through different phases of clinical trials. The vaccine that exists for another virus causing Ebola, what we call Ebola Zaire, Ervebo vaccine, is now being looked at if it can offer some protection for Bundibugyo virus. So that has been prioritized. We have a technical advisory group on vaccines that looked into issue and said that Ervebo, so existing and only licensed vaccine against Ebola, we should go into phase 3 trial to see if it offers protection against this virus causing Ebola disease. So this is something that is being looked now by the government of Democratic Republic of the Congo, how this trial can go on and how we can offer that protection. It has to be proven. It has to be proven yet that it offers the protection. But if that's the case, how it can be rolled out. But again, in the meantime, we really need to look into basic public health measures. When it comes to therapeutics, there are already trials for 2 products that are going on right now. So we are awaiting for the results. But beside, again, as I said, beside vaccines and possible medicines, for the time being, it's really what we are seeing in your images is treatment centers and really trying to get people to understand how important it is to cooperate with the health authorities.
Indeed. Tarik Jašarević, we'll have to leave it there, but thank you so much for your time and bringing us that insight. Very much appreciated.
Thank you.